vision is a direct correlation to their education. I think if they're struggling with studying and doing their work, I remember we were doing vision screenings and this kid needed like an extra 45 minutes because it took him so long to do the test. When I did his vision screening and I saw what it was going to be, and I'm like, no wonder he can't see. And he didn't have glasses on. I'm like, he literally cannot see.
There are so many children that may have, they think behavioral issues when it's really vision issues. They can't see and they don't know any different. And when they're born that way, they don't know that it's blurry. And there's a lot of kids that their parents just can't get them somewhere.
We've come across a lot of kids that, yeah, we can get them their glasses and that's helping them out. But we've also identified like, something else is off and maybe there's something, is off in your body. And so we're able from there to refer them to medical, and other really like major health concerns have been brought up because it started with an eye exam.
Have your children dilated. It's very important, because there's things that the doctor can't see without dilation. If they have a retinal camera, that's great, but that's not a lot of times offered. So definitely get your children's vision checked and make sure that they have a dilated eye exam.
That is my piece of advice, is to continue to do your annual eye exams. Even if your child seems to be fine, they're not complaining about anything, still go in and if you can, establish a vision home.
There's a program called Infancy, and they can see them at 6 to 12 months. So anything from 6 under 12 months, that is usually a free visit. It's called an infancy program.
So it's actually, super young. They're not gonna say, answer better one, better two, but there's enough technology nowadays that they can do a thorough exam, see if there's eye concerns. And yeah, if you can start that early, most eye muscles aren't completely developed until you're 8 anyways. So for us, we see a lot of kids who have amblyopia or like eye turns, and you can recorrect that. Your eye's just a huge giant muscle. And so if you can do certain exercises with the kids ahead of time, you can correct that, which will correct their vision and other aspects of their life later on.